We're going to record this and we are going to put it up on our YouTube channel so that people can watch it and share it with others. But thank you for being here. It was a very, very eventful legislative session. Many people who have been doing this for a very long time said it was one of the most eventful sessions that they have ever, and unusual sessions they've ever experienced. So I'll take their word for it. And we, MDAC, worked really hard over the course of this session. So we just thought we would do a little wrap up about kind of what the outcomes were and how you can kind of expect those outcomes to impact your families and then think together a little bit about how we're going to move forward and what the next steps are going to be. So thanks for being here, and I'm going to turn it over to Adrienne to begin our presentation.
Thank you, Liz. My name is Artyom Forsyth. I'm really excited to be here to talk to you today. I am one of the co-hosts for this presentation alongside Liz and Gabrielle Forsyth. Um, Here is what we're going to be going through in this presentation. Um, we will discuss the purpose of the presentation. We're going to discuss DDA, education, and bill roundup, and MDAC action and advocacy, and what is next. And next slide, please. So the purpose of this presentation is what happened in the year of 2025 Maryland legislative session, how it will and how the legislative session impacts our community, the kinds of actions and advocacy that we took as a community, and what we have learned, and what we will do next. Take it away, Liz.
Okay, so before we dive into the details, I just want to kind of quickly review the sort of basics of the budget because I think that's kind of important background context. So, first of all, the major thing that has to be done during the Maryland legislative session is the development of the budget for the next fiscal year. And the fiscal year starts on July 1st. So when you hear them talking about the fiscal year 26 budget, because that's what they were working on during the 2025 legislative session, that fiscal year budget begins July 1st of 2026 and goes until June 30th of 2027. So the budget process begins when the governor proposes a budget to the legislature, and then the House and Senate have to, by the end of the 90-day session, pass a budget. That's the most important thing that they do during session. And while they can add and change things over the course of that 90 days, at the end, the budget has to be balanced. So the governor introduces a balanced budget, and then the legislature has to pass a balanced budget, meaning the amount of money that it will take in revenue has to meet the amount of money that it is going to spend. Okay. So in this budget year, we knew coming in that it was going to be a very difficult year because we began with around a $3 billion shortfall, meaning Maryland was spending more money than they anticipate taking in as a state. And so there's two ways to deal with that kind of a deficit. You can either cut spending or you can take in more revenue through taxes and fees. And the governor's original budget proposal had about $2 billion in cuts and about $1 billion in new revenue generation. And the final fiscal year 26 budget totaled about $67 billion. So that just gives you kind of a level set on kind of what it is that we're talking about in the environment that we were entering into. And now Gabrielle is going to talk a little bit about the Developmental Disabilities Administration and the budget piece related to that.
Yeah, so within the budget, the DDA or the Developmental Disabilities Administration gets its own budget. And what we want to highlight here is this was originally when the budget was first put out, one of the main places where they were making cuts in the overall state budget. So We can see here the two funding years, the original proposal, and then the final where we ended up at the end of the budget negotiation. So if you look at the original proposal for fiscal year 26, they were proposing to cut, almost $500 million from the DDA budget. So we just want to emphasize here the scale of that cut. It's a very, very substantial cut. But then also looking at the amount that was restored. So through the advocacy that we did, and through the voices from the community that reached the lawmakers, they were able to restore in the fiscal year 2026 almost $300 million. So again, a substantial initial cut, but then a substantial restoration of that budget. So I think what's important to note here is the advocacy really did a substantial amount of work for the community, and we were able to bring a lot back. Also, just a couple notes that through the end of the budget setting process, some additional money was added in for spending deficits that had been identified since the beginning of the budget process, which added, another substantial chunk of money back into the budget. And that ties into some information later about the information that is available from the DDA and their cost estimates for services for the community. And then as a final note here, you can see the total final budget number for the DDA was $2.7 billion out of Maryland's total operating budget of about $67 billion. So again, just emphasizing the scale here. This is a really important piece of the budget. And they were, these were pretty big numbers that we were talking about this year. In the next slide, I'll go into some of the specific details on how those budget items were proposed to be cut and then restored. So these are basically the specific areas where they were talking about making cuts and then where restoration happened in the budget. So I can talk through each of these pretty quickly. The dedicated hour rate is a rate for providers providing dedicated one-on-one hours to participants in their service programs. They had proposed a more substantial limit, but ended up decreasing the rate only very slightly. For reasonable and customary wages, those are the wages that are paid through providers, vendors, and employees under self-directed services. They had proposed limiting, adding a new limit to existing wages, but they ended up leaving them at current funding levels. The next two, the geographic differential and the wage exception, those are extensions of the reasonable and customary wages for either participants in certain geographic areas, high cost areas within the state, or in areas where, for the geographic differential, where higher wages need to be paid just out of a lack of available support services. So those extend the reasonable and customary wages, and originally they had proposed just eliminating those entirely, which would have been a very dramatic cut to providers and to the self-directed community. And they ended up just putting a cap on those. So they kept them, they kept the geographic differential and the wage exception, but with a limit. And actually in the next slide, I'll go into that in a bit more detail. They also kept a limit on individual and family directed goods and services. But with a couple exceptions, they moved out this specific role, the day-to-day administrator role, into a separate line item so that the cap would not apply to that position. And they have not, I believe, yet specified the actual cap amount. We're assuming it'll be $5,000 because that's, I believe, what it had been capped at before. But I believe that's now up to the DDA to decide moving forward. And then finally, the low intensity support services is a grant that that individuals and families in the state can apply to for kind of low dollar amount supports for specific activities. They had proposed eliminating that, which would again, have been pretty hurtful to the community because those are often funds that are used by individuals that are not yet on full services. But they kept it in, but again, put a cap or reduced the cap from $2,000 to $1,000. So the overall story here is they proposed eliminating a lot of things, but ended up keeping them, but putting caps. So, no absolute victories here, but some substantial victories in avoiding the worst of the damage that could have come. Okay, next slide. And here I want to look at one specific example of how the caps will affect services in the state. So here we're looking at the wages for ongoing job supports, and there's maybe quite a bit of information on this slide, but I think it will actually help us kind of understand the new situation if I kind of just talk through it a little bit. So I'm going to talk through what this chart is actually showing us. I'll talk in a little bit of basic detail because I'm not sure how familiar everyone is with all the details here, but through waiver services in the state of Maryland, you can receive services either through a provider or through self-directed services. And even through self-directed services, you can hire a provider, a vendor, or you can hire your own employees to work directly for you. And each of those categories has a different standard wage or maximum wage associated with each of the service codes or each of the jobs available within that delivery system. So here we're looking at ongoing job supports, which is one service code I'm pretty familiar with and I think is pretty representative. But there are others, personal supports, nursing, community development. These are all types of services that can be provided through each of these delivery models. So, and then I mentioned the geographic differential, which again is if you're in one of a small number of counties, Montgomery, PG, I'm not sure which others, you have a higher maximum wage that you're allowed to pay individuals through the waiver service. So the standard wages, which are, if you live in one of the other counties, that's the maximum amount you're allowed to pay through the waiver. Those remained the same. So that's good news. They didn't cut it. But on the other hand, there had been a 1% increase planned that they also took away. So again, they're staying the same, which is half of a win and half of a loss. So that's what the dark blue bar is here. That's the maximum wage you're allowed to pay through each of these delivery models. The red bar or the end of the full bar was the old geographic differential wage that you were allowed to pay previous to these new budget changes. And the lighter blue bar is what is the new limit the new imposed limit on the geographic differential, and in the last bar here, on the wage exception available for employees in self-directed services. So that's a lot of information, but basically the what I'm trying to show here is that the red sections on each of these bars is the amount of wage range that was cut in this legislative session. So um, uh, so for example, for employees in the geographic differential, previously the highest limit was $75 an hour for ongoing job supports. Now it'll be cut down to about $40 an hour, so a pretty substantial cut. And one of the things just to notice here, I think, is that the cuts on, providers and vendors is relatively smaller compared to the cuts for employees through self-directed services. So I think that in terms of impact, who's going to feel this the most is individuals on self-direction who are hiring their own employees and have been using the geographic differential or the wage exception to access higher ranges of wages for their employees. And Adrian, I don't know if at this point you want to say anything about, because I know you use self-directed services. Do you want to say anything about how you think this might affect your services?
Yes, thank you. So through self-direction, I get support in several ways. I hire students from the University of Maryland as job coaches. They assist me in setting up meetings and creating agendas so I can then lead meetings. They also help me by taking notes for me in meetings, reviewing my to-do lists, and due dates. They even encourage me to be independent by fading their support. They help me researching things that are important in my job and creating visual aids to help me to understand information. Overall, this is a short list of how I use my job coaches. I also have a support broker to train job coaches to set up goals with me and have weekly and daily check-ins with job coaches to see how things are going. My job coaches and support worker form a team. I also have a budget for registration to organizations and activities and Uber drives, so I can be fully included in the community. And these are the three ways I use self-directed waiver services. Thank you.
Yeah, and I know so Adrian, I know you use ongoing job supports as well as personal supports through your waiver, and um, we work a lot uh, with younger people. I know that you work with individuals from the University of Maryland, undergraduates, sometimes graduate students, and already with those individuals, we're running up against the standard wage limit. So I know, if and when we explore um, uh, 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 mid-career or further later career individuals or more specialized supports, we're going to be running into barriers with these new wages. So it has very, concrete impacts, I think, on self-directed individuals. Okay. One more slide just on some of the impact of some of these DDA changes. So one thing that doesn't actually affect the total budget is that Well, one thing that we heard through this process was that the appropriations committee and the people writing the budget were having trouble getting information from the DDA on how their services were being used, how much of the growth of the budget was due to new enrollees versus expanded use of existing services, or whether people like what wage rates people were using for their services. And so I know that we heard feedback that this was making it hard for them to make clear decisions about how to shape the DDA budget. So actually, one thing that was written in um, later in the legislative session was that some of the funding to the DDA is going to be contingent on reports that the DDA will provide to the legislature about exactly those questions about spending on community services, and also on cost containment efforts, and some of those details are listed here. But overall, I think what the impact that individuals should be aware of is that at this point, the DDA has a lot of authority over how to implement this new budget and what kind of decisions to make about um, recommending future cost containment activities, or uh, how to best capture data on usage, and how to engage the community on collecting that data. So so uh, um, I don't know exactly how that will play out, for individuals interacting with the DDA and receiving their services. But I think individuals should be, and families should be aware of the role that DDA will play over the next year in addressing some of these concerns and in shaping how some of the questions that were raised in this budget cycle will be addressed in future budget cycles. And I think that pretty much wraps up my portion on the DDA.
Okay, great. I did want to pause here if there was specific questions about the DDA and the budget process, and I cannot see the chat and I cannot see people's hands. So Jen, do you see any questions that we should address now? We could also ask questions at the end.
There's currently no questions in the chat and no hands raised, but
Okay.
we can give everyone a moment in case there are something that needs to be posted, or raise your hand.
Great, please do that. And while we're doing that, I'm just going to add one thing to this conversation, which is looking at the bar chart that Gabrielle had created. One of the things that and hearing about the way that Adrian uses his services, I think that it's important to just keep in mind that part of the idea of self-direction is that everyone should have access to a self-directed services model if that's what they would like to choose. And so there are lots of people who use self-directed services who have quite high support needs, and who may need specialized supports, people who can help them with both their job supports and their behavioral health needs perhaps at the same time, and that those folks are going to need a higher wage. And so I think it's just important to kind of keep in mind how those kinds of changes that they're making are going to impact people kind of across the spectrum of support needs.
Yeah, that's a great point. And those caps, I should say, are across all service categories. So there were no exceptions made for nursing or behavioral supports, or supported living, any of the more kind of substantial cost intensive categories. So those cuts or caps are across the board.
Okay, we're going to go ahead and move on to education, and then if you put them in the chat or save them for the end. So funding pieces all came through, were contingent on legislation, because education funding in our state follows formulas that are in legislation called the Blueprint for Maryland's Future. So there was a law, a bill that was put in by the governor called the Excellence in Public Maryland Public Schools Act, that called for making a lot of changes to the blueprint. And I'm not going to get super into the weeds on all the different pots of money, but these were the basic areas where there were cuts that were proposed. And again, just like Gabrielle showed, around what happened because of people's advocacy and education advocates, including us, being involved. So there was a cut proposed. The biggest cut came in a cut to the foundation per pupil funding. So the funding that follows every student who is enrolled in pre-K through 12 public schools in Maryland. And that cut was small in the first year for the fiscal year 26, but the way that it was built into the legislation, it ballooned over time so that it was ended up being a total of about $4.1 billion over 8 years. It was about halved by the time we were done. So there was no cut in fiscal year 26, and then about 750 million over 4 years and 2.1 billion over 8 years. These next two buckets, that foundation per pupil funding is the basis for weighted funding that is added for students who need additional support for different reasons. So this compensatory education bucket has to do with students who are economically disadvantaged. Those students we know take more money to educate, and so there is an additional weight that is added for every student who is eligible for free and reduced price meals. Because in the law it had been tied to the foundation. It was multiplied. So it was like 0.8 times the foundation per student, that it was impacting that. They basically severed that connection for compensatory education and multilingual learners so that there's just a flat amount of money rather than a weighted amount of money. So they severed that. Same thing, they had already done that for special education. So we were already spared that cut in our special education cut. And then community schools, you may have heard about community schools, has to do with wraparound funding for schools that have higher concentrations of poverty. And that funding was restored. And then behavioral health services, that cut went from 90 million to 30 million. So this just kind of as a visual, you can see kind of what the magnitude of the cuts would have been over 8 years, over 4 years, and next year in the original proposal, and then what we ended up with. So, we made a lot of progress. And we're trying to count that as a win. And then in terms of the policy changes that happened, there's a number of different buckets, and I'm going to focus on a couple of them and give you a little bit more detail that really impact our students in particular. So collaborative time, and I'm going to talk a little bit about collaborative time because that was kind of where the foundation cut came from. That was the money they were trying to cut out, was for this program they call collaborative time. It has to do with adding additional time into every teacher's day so that they are spending a higher percentage of their day working with other teachers to plan instruction, to look at student data, to work with small groups and individual students. And it was conceived of in the blueprint as we would hire additional teachers in order to fill that time. So the students still had the same amount of instructional time in their day, but their teachers would be spending more time rotated out of the classroom. We were going to go from a 20/80 split of non-instructional to instructional time to a 60/40 split. And that was supposed to happen over an 8-year period. Collaborative time was originally proposed to be delayed for 4 years. And by the time the bill was ended, what ended up passing, it's a delay of 3 years. There's going to be a special education funding study, and there were some proposed changes to what that study was going to look like. and it ended up getting reverted back to the original proposed study. There was, at the very last minute, an amendment added around accessibility, around digital tools that incorporate artificial intelligence. Right now, we have a law in Maryland, it passed a couple of years ago, called the Equivalent Access Bill. And that law requires that school districts only procure, but purchase for use for students, digital tools, software programs, et cetera, that are accessible for all students. And that they put in an amendment here to exempt for a period of time digital tools that use artificial intelligence, because there was a sense that there was a few AI tutors, tutoring programs that could really help students learn how to read and do math, and that school districts were being prevented from using them because they're not accessible. And so that exemption was passed for 2 years. Really a very last minute kind of amendment. And then these last three are important, but not as important maybe to our community. One was this, some adjustments were made to community schools flexibility. There were changes made to make that program a little bit more flexible for school districts. I'm not going to talk a lot about minimum school funding because it's complicated, and I don't think we need to get into the details, but they ended up not making any changes to minimum school funding. We'll leave it at that. And then this last piece has to do with a trigger. So right now, the way the blueprint was originally passed, it had a trigger built in that said, if we have a catastrophic loss of revenue over the course of about 9 months from March through December, then we will flat fund education the following year. And they tried to greatly expand those triggers in the law. And they added not only general fund revenue, but also federal funds, saying if we have a huge drop in Maryland overall, not just education funding, but just in Maryland from federal funds over the course of a 9 months, that education would be flat funded. And I'm sure that you have heard that we can probably expect some catastrophic loss of federal funds in Maryland. So that federal fund trigger was taken out, but the general fund trigger was less expanded by lowering the threshold. So instead of 7.5%, it's now 3.75%. All right, so I just want to dig in a little bit more on sort of what the end result impact for students with disabilities is. So the number one thing I would talk about is funding. So we saw that bar, it shrunk quite a bit. And this next year, we will not see the hit that we were originally anticipating of about $300 million. So that's good. Our extra weight of funding, our extra sort of layer of funding for special education has been protected next year and all years going forward. So that's good. But it's important for us to recognize, and it's something that we spend a lot of time talking to legislators about, is that when there is inadequate foundation funding, so the funding that every student gets, whether they're in special education, get special education services or they don't, whether they're multilingual learners or they don't, the funding that follows every single student, that has to do with the design of a whole school. It's the funding upon which we staff general education classrooms and all the things that are happening in a school, not the special pieces, but the basics of a school. When that funding is inadequate, it harms our students more than it harms other students. And why do I say that? Because we know that when a general education teacher doesn't have what they need in their classroom, when they have when they go from being a classroom of 25 to a classroom of 30 because their funding has been cut, which students are going to be the least likely to succeed in that classroom? It's going to be students like ours. And what is the consequence of that lack of success for our students? It's that they are going to be moved to a more restrictive placement. And we know that the research shows that that more restrictive placement will end up with a worse outcome for students. So that foundation funding is really, really important. And the loss of $2.1 billion over 8 years is a huge problem that we are going to have to continue fighting. I spoke a little bit about collaborative time. Collaborative time wasn't thought of necessarily, dreamed up as a program to meet the needs of students who receive special education services. And yet anyone who's had a student in their family who's gone through a school knows that that collaborative time between general and special educators is the key, really, to success for our students. It's the time when content experts, the people who know the curriculum, who are general educators, spend time with the people whose expertise is in specially designed instruction. And without that time for them to do planning and think about students, it's really hard for our students to be successful in a general education classroom. And so we talked to legislators a lot about how important collaborative time is, and that it really is the part of the blueprint that is most likely to impact our students positively. It is also a research-based retention strategy for teachers. So the reasoning that was used for cutting collaborative time from the blueprint was that we have a teacher shortage, and therefore we can't implement collaborative time. And we kept coming back and saying, but it actually is a way to retain teachers. Teachers are more likely to stay when they have more time to work with their colleagues. So that's a little, and again, the teacher shortage is impacting students with disabilities more than it's impacting other students, because special education in particular is an area of shortage. This special education study that was called for in the law was a recommendation of the Blueprint Special Education Work Group that I've been co-chairing for the last 2 years, and is about to come out with our final set of recommendations. And this special education study is about funding. So it asks the state to conduct a study that will probably cost about $1.5 million, to do an analysis to determine how much should we be spending on special education. And the work group wrote a scope for this study that we recommended. And we wanted the study to be based on the idea of adequacy. What would be adequate funding for our students? The study that ended up getting passed in the law instead asks for a study of costs. So rather than saying what would be adequate for our students to achieve grade level standards or to meet their goals, they're going to ask, well, what are we spending? And that's a really different question. So we're not happy with the way that the study ended up being put into the law. We also really asked in the scope that the work group suggested that they consider transportation costs and the cost of non-public placements as part of understanding the overall costs of special education. And that was left out. So we're going to keep working on that, but that's going to be an area of some advocacy as well. I talked a little bit already about the AI tools, and that's going to be an area where, I think part of the problem is that school districts don't understand what tools use artificial intelligence and which ones don't. So it becomes hard to implement an exception. And I think we should be concerned about technology being used for students that isn't accessible. And then, of course, all the concerns about the federal uncertainty and the oversight of special education are things that kind of set a context that make this whole thing a lot more difficult. Okay, so that's the education piece. And I'm just going to we'll just kind of quickly go through some of these bills that we followed. And but if anybody has a question, are there any questions? No. Okay, we're going to keep going. All right, so we submitted a whole bunch of testimony about a whole bunch of bills, and I'm just gonna point to a couple that are of particular interest. So there was a bill that passed called the Mixed Delivery Viability Act, and it had to do with asking MSDE to review and do an analysis of the mixed delivery system for pre-kindergarten. So the blueprint has an idea that we're going to expand pre-K to all 3 and 4-year-olds over time. And we're going to do that by having both public pre-K and private providers get public funding to do pre-K. And it's been very challenging because we haven't succeeded in getting a lot of private providers to take public funds in order to do pre-K expansion. And so they're going to do this review, and we asked them to add an amendment, which they did incorporate in, to make sure that when they're doing this review, that they are thinking about, because they're going to make recommendations about how we could do this better, to make sure that they are thinking about how expanded pre-K can serve students with disabilities in all kinds of environments and in inclusive environments, to make sure that what we don't end up with is a system where all students with disabilities go to public pre-K because private providers are not adequately resourced and don't have the capacity to meet their needs. So we're really happy both that the bill sponsor, which is Delegate Feldmark, who's somebody that we have a good relationship with, that she incorporated that amendment was great. The DDA Waiver Advisory Council, which was HB 1244, was Delegate Michelle Guyton, also a Baltimore County delegate, and that also passed. And we're going to talk a little bit more about that at the end, because that's going to create some opportunities for advocacy over time. But as Gabrielle talked about, kind of thinking about these cost containment measures and how they're going to play out over time and what kinds of advocacy we need to do at the DDA, this Waiver Advisory Council is hopefully going to provide some additional opportunities and ways for different kinds of stakeholders to be heard as those changes and that oversight happens. The next one is the Preserve Telehealth Act. So during the pandemic, there were some flexibilities added so that doctors could provide services to folks on the phone or through different kinds of telehealth. And some of those avenues were being expiring. And so this act was extended telehealth as a way that people could get, doctors can get reimbursed. So that was important. I know that's really important for a lot of our families who may live far away from some of the specialists that they need to see, and they need just a check-in. They might need to make a phone call, and the doctor can charge them $50 or whatever, however that works. But they can't do that if it's not allowed. So that Preserve Telehealth Act did pass, which is great. The next one is kind of a really interesting one. So there was a bill that went in, SB 748, HB 1004, that had to do with a data collection around the prevalence and treatment options for Alzheimer's disease. And I was really glad that Amanda Mumbert, who's the executive director of DSAMD, alerted us to this bill, and we asked for an amendment that so the idea of the bill is that they were going to collect information with a series of different data pieces like race, ethnicity, age, geography, about people who have a diagnosis of Alzheimer's disease, and then also extend information around different kinds of treatment options. And we asked that they add an amendment that in that data collection, they collect information about people who have a diagnosis of Alzheimer's disease and also have Down syndrome. And they accepted that amendment, and it was passed in both the House and Senate. And so that's great. That will go into effect later this year. And they'll start building this data dashboard where we'll be able to get more information about where folks with Down syndrome who have Alzheimer's live in our state, and other information about those folks. It also was just a great opportunity to expand people's knowledge about the co-occurrence of Alzheimer's and Down syndrome. And we got a lot of really great feedback about the testimony that we gave and And just it was very eye-opening, I think, for members of the legislature. So that was great. It's really kind of the reason why MDAC exists, right? Is to make sure that people are thinking about our community in contexts where they might not otherwise be. So that was a great one. Equal access to public services has to do with two different groups: individuals with disabilities and people whose first language is not English. And it was to create a structure within the state government. It will be a collaboration between the Department of Disabilities and Office of Immigrant Services or something like that. I can't remember what it's called. And it will make sure that state information and services are accessible to folks in terms of language access and in terms of whether you digital accessibility. So that bill passed. And then several bills that didn't pass included an expedited voting act that would have allowed people with disabilities and elderly voters to have a way to not wait in long lines to vote. The impact of reduction in health and community support services was a bill to make sure that should cuts be made in future years, like we saw come out of in the initial governor's proposal at the DDA, that the impact on individual people for those kinds of reductions would have to be explained in the legislation. The blueprint alterations bill, some pieces of that were incorporated into the education bill that I talked about. The one piece that didn't was something we've been advocating for a while, which is we talked about pre-K expansion. One thing that was not part of the blueprint is that students with disabilities should be considered in tier 1 for pre-K, and right now they're not. And so that was in the blueprint alterations bill and unfortunately did not pass. And then three other quick bills that we followed. One was TERP Succeed program funding. There's no funding this year. TERP Succeed, of course, is the inclusive college program at University of Maryland for students with intellectual disability, where our own Adrienne Forsyth works. And unfortunately, there's no funding this year for it, but it creates a line item so that it can be funded by the state in future years. I think $350,000 is the amount there. A student elopement bill, HB 1204, which requires schools to let families know on the day that their student attempts to elope school, so that families can address it immediately. And then this Office of Disability Employment Advancement and Policy in Maryland as a model employer initiative also passed. It will create this office in the Department of Disabilities. There's no funding that's associated with that. And then the last thing I wanted to mention is this one bill that I followed, but we did not submit testimony on, but I'm going to, it is an area I think that would be good for MDAC to be involved in. This bill was around criminal procedure and out-of-court statements for vulnerable adult victims and witnesses. So it allows for when there is a vulnerable adult who is the victim of a crime or witnesses a crime, that their statement can be taken outside of the court setting and still used as evidence in a court. And it is right now that is not the case, and it leads prosecutors to not want to prosecute some kinds of cases that can impact our community because witnesses with intellectual disability are sometimes considered not reliable witnesses. So that's one that we'll follow in the future. Okay, so so we did a lot this year during that 90-day session. At the beginning of session, we did a meeting kind of like this to talk about, kind of get people ready to write testimony. We sent out a lot of information about who to call and who to email and when and why. Some ideas about writing testimony or giving oral testimony. And we had a number of folks who came down to Annapolis and did testify in person, and others who submitted testimony. We worked in a lot of coalitions, which is really, very important. We had a number of people on MDAC who were also serving on the GAC, the Government Affairs Committee for the ARC, and participating there. We worked in coalition on education issues as well. We had a lot of folks from MDAC who participated in Developmental Disabilities Day, and that's always a great day. And this year, I think there was about 1,000 people down in Annapolis that day, which is great. And then Adriana is going to talk about the next few things: self-advocacy training, our MDAC Day in Annapolis, and World Down Syndrome Day.
Awesome, thank you, Liz. In January, in January 29th of this year, I co-hosted with Devante and Melissa. We decided to create this thing called a propaganda. There's a part 1 and part 2. Part 1 was in January. And this was through Zoom. And the goal of the propaganda is to teach the self-advocates on how to talk with your legislators using improv games. An example of a game is this, it should describe the things that you like, the things that you don't like, and the things that you dream. We had about like 20 participants in that propaganda, and it was through Zoom. In March, we had an in-person propaganda, and this was in the Mentally Dental in Columbia. Again, I was co-hosted with Devante and Melissa. And again, we were teaching self-advocates on how to talk to the legislators using improv games. And we had like 20 participants. And in February, I co-hosted with Liz and Devante. We went to Judy's Playhouse in Annapolis, and we worked on how to write leave behind letters that describes how a certain legislation impacts people with disabilities. There we had 7 participants. Next slide, please. Thank you. On March 11th, now I'm going to talk to you about MDAC Day in Annapolis, and this was in March 11th. We had 36 people, and that includes 11 self-advocates. They visited the delegates and senators in their offices in the state of Maryland. They dropped off invitations to World Down Syndrome Day. The theme for World Down Syndrome Day this year was "I am valuable, invest in me." They give out mismatched socks and the leave behind letters from individuals with Down syndrome and information about Down syndrome and MDAC legislative proposals. Next slide, please. Okay, World Down Syndrome Day. First, 2 or 3 self-advocates receive a proclamation. Then we had a rally. It was a gorgeous day. People with Down syndrome, including the legislators spoke, and we also had a chat like, I am valuable, invest in me. And then we had a celebration. And then we had a celebration with dancing and music. Secretary Baby came to the celebration and she spoke. That's why I have that deal. The music was directed by um, DJ Anderson. He is he has Down syndrome and he owns a business, but he is like the DJ in Down syndrome dances. He's a really cool guy. um, Next slide. So what's next? Well, right now we're recruiting self-advocates to register for the Maryland Down syndrome advocacy members. Um, we're also planning future events for 2026 and for recruiting self-advocates for the DDA Waiver Advisory Council nomination process.
So we're waiting to hear how that process is going to play out. That the law, that DDA Waiver Advisory Council, the bill that it was in, goes into effect October 1. And so when we find out about how folks can self-nominate, we'll let people know. But it's going to be really important, and I think you saw from the information that Gabrielle shared that as particularly self-advocates who self-direct their services, really need to be a part of that waiver advisory council to represent their interests and to make sure that people understand how changes to their waivers really affect them. When we send out a note after this, we'll make sure that we include with it the registration link, both for our general, the sort of family member MDAC registration and our self-advocate member registration forms, so that we can make sure that folks are signing up. In terms of additional state level advocacy, during the off session, we're gonna just kind of keep plowing along with meetings with legislators on some of the issues that we have to keep working on. There's opportunities to do public comment, different boards and meetings. Make sure you're going to community events and talking to your state legislators. I tend to see my state legislators at the farmers market, wherever. I know that Mike McLaughlin talks about it, he runs into Senator Rosapep around the town. So they're out there, and make an effort to reach out to them and say hi when you see them. We'll do a work around the walks in October, making sure that we've got materials that folks can give out and sign people up for MDAC. And then World Down Syndrome Day and DD Day, will be back around before you know it. So we'll work. Those are sort of all the opportunities we take for state level advocacy. In terms of federal advocacy, there's a number of things that are coming up. One is May 5th at 7 o'clock. Heather Sachs and Ricky Sabia from MDSC. I love how I just put their first names. Heather Sachs and Ricky Sabia from the National Down Syndrome Congress will be doing something similar to this, but talking about federal issues. And so I really encourage everybody to kind of turn our attentions from Annapolis to Washington, D.C., if you've been able to take your eyes off of Washington, D.C. at all over the last couple of months. And as part of that, we'd like to think about bringing a group of advocates from Maryland down to the Hill to go around and talk to our representatives and set up some meetings. We've done that a number of times, so in the last couple of years. And we have a number of new representatives that represent different parts of Maryland. So it would be great. It would be great to if you're interested in that, let us know, and we would love to include you. And then I think the other thing in terms of federal advocacy is just, we will do our part to make sure that people in Maryland know about opportunities with national organizations and coalitions, to figure out different, action alerts and ways that you can be involved. So just stay tuned for those things. And then also just to have on your radar, about 2 years ago, we took about 25 people to the Maryland State Board of Education meeting in June of 2023. And a number of us did public comment to talk about the importance for our community of children with Down syndrome going to school with their neighbors and siblings. And it was a pretty powerful day. Now that we've kind of reached the end of this special education work group that we've been doing, it's a nice time to kind of go back and revisit and suggest some changes that we think could be made. So we are planning on doing that again in June, on June 24th. And if you have a student who is currently attending a Maryland public school, we would love to have you join us for that. The state board meeting is in Baltimore City, and it's a pretty small room, so it doesn't take a lot to pack it, and that's really nice. And they don't see students that much, so it's wonderful to bring students to those meetings. Someone noted in the chat that I made a mistake on one of the very first slides when I talked about the fiscal year. The fiscal FY 26 begins July 1st of 2025 and extends through June 30th of 2026. And I messed up the years. So I'll fix that in the slides before we send out the slides, but I apologize for that error. All right, so let's stop the share and see if anybody has a question.
It looks like there was a question for Adrienne in the chat. Adrienne, there's a question from Christy that says, did you find that the training, so the improvaganza, how do you think that helped the self-advocates get ready for the MDAC Day and World Down Syndrome Day?
It really is useful to use the proper improv games to help with talking to the legislators, because they need some support in how to express what they want, their needs, and to understand their rights, so they can tell the legislators, this is what is affecting me. I want your support. I need this to happen. I have a dream to go to post-secondary programs or getting married one day. So it really is an essential tool for them to apply and use that when meeting with legislators.
And I think one of the things that was really great about that training and the training that Adrienne did at Gigi's Playhouse was, I think it's really powerful and important for our self-advocates to lead our self-advocates, right? And lead the trainings for our self-advocates. And that, and at the Gigi's Playhouse training that Adrienne did, which is a presentation he's given a number of times in different contexts, they wrote the letters. And then many of those folks came to MDAC Day in Annapolis and delivered those letters themselves. And so, right, they got to kind of go through the whole process of thinking through what it meant to say, I am valuable, invest in me, to write down to whom they are valuable and how they wanted the state to invest in them, and then to get to go and deliver those letters and kind of see the impact. So, yeah, pretty important. The time of the board meeting on the 24th is 9 o'clock in the morning. There is an afternoon public comment period. But I think we might have more. Well, we can talk about that. There is an afternoon. They have added a public comment period in the afternoon, and we could potentially do that. We could talk about that. If people are interested in that, we can talk about it.
Liz, I also just wanted to point out real quick for those of you who are not checking out the chat, I put in the links to the NDSC, the National Down Syndrome Congress, update on federal national issues related to the Department of Education and other national policy issues. And I also put in DSNMC and DSA Maryland are partnering to host a self-directed services panel presentation with families who are receiving self-directed services in a variety of ways, along with a DDA representative. So I put the links in there, and those are coming up in the next couple of weeks.
They're next week. I mean, that
Are they both next week?
no, the self-directed services